I'm Dr. Roja Eddy, completed BMS MD in Ayurveda. I completed my MD from Jamnagar, ITRA. Currently, I'm working as a consultant physician in Ayu Central BTM layout, Bangalore. We shall start the case. A male patient of 76 years came to me with complaints of low backache radiating to right lower limb since 1 month aggravates during sitting posture. When a patient came to me, he is of 76 years old patient, he was complaining of severe low backache which was radiating to right lower limb since 1 month, and it is more aggravated. He has intense pain that he is unable to sit and elaborate his history even for 10 to 20 seconds. So he was standing on his own and he was telling history. So he didn't have any history of trauma or self-fall. He didn't have any previous surgical history, but he is a known case of diabetes mellitus and he is on continuous treatment from past 20 years. Okay. And all these problems, the low backache problems arise from uh, last 1 month. Okay. Here in examination ease of lean person, I will show you all the videos. Okay. In general and systemic examination, it was completely normal. In neurological examination, reflexes are done. The reflexes which are for lower limbs, it was done like Babinski sign is done, that is for upper and neural motor lesions, but these are because it is restricted to lower limb. Then a knee jerk reflex has been done. So muscle strength was normal, power was normal. We'll put some pressure over the thumb, over leg and thigh, and we will tell the patient to lift the leg under our pressure. So we came to conclude that as power is 5/5. And sensation is normal when you prick with the pen. There also in sensation, two types will come. Fine sensation, then coarse sensation. Fine things, then you can appreciate. Like if you prick any of the area, then they will get some pinching pain. And if we, 1 minute, some students are joining, so I'm letting them admit. Okay. And when it comes to SLR test is done. How it is done, I will just give you a brief introduction regarding that. SLR is nothing but SLR is nothing but straight leg test. Will tell a patient to lie down in supine position with the hip flexible, and will tell thigh and leg should be in straight position. It should not be bent. We will tell a patient to lift. Okay, then patient will feel pain at some degree. That is from, if it may be 30 degree, it may start from 30 degree, it may go up to 90 degree. If the pain is between to 30 to 70 degree, then it is of sciatica,
Yeah?
we'll conclude.
Oh, yes.
Okay, then Bregard's test is
Vanilla
done for
vasante
dorsiflexion of
ಕೇಳಿದ್ರು ದೇಶಲ್ ಎಕ್ಸ್ಪ್ರೆಷನ್ಸ್
SLR
ಎಲ್ಲ
test, which indicates at
ಆಕ್ಟಿವೇಟ್
the head
ಆಗ್ತದೆ
disc.
ಫೇಶಿಯಲ್ ಮಸಲ್ಸ್ ಎಲ್ಲ ಒಂದು
Okay.
ಎಕ್ಸ್ಪ್ರೆಷನ್ ಕೊಟ್ಟು
See, this is the sciatic nerve. Those, if some are the
ಒಂದ್ಸಲ ಹಾಕಿಲ್ಲ
students, though I'm showing you here is, this is the sciatic
ಅವರು
nerve, how it
ಕೇಳಿದ್ರಲ್ಲ
passes.
ಬಟ್
Patient will come with complaints of low backache, which is almost
ಹ್ಮ್
near to the buttocks. Sometimes patients may tell us the pain will start from here, from half of the buttock, and it is radiating pain is a specific pain for sciatica. Okay, which is specific, and the pain is very intense. Patient cannot able to sit, not able to lie down. The pain will be severe. So that is a radiating pain till heal of the patient. Okay. This is the cause of the sciatic nerve. One more diagram I will show how. See, it is a group of nerves. The sciatic nerve is the largest nerve, which is a group of nerve which is made up of nerves from L4 to S3. See, if any herniated disc is there in this place, so it will compress the nerve. Okay, they're very tense. From here, patient will complain of pain anywhere, even from L4 or L5 or S1, S2, S3, anywhere. If there is an any early night disc, if there is a spondylolisthesis also, so you will have the sciatic pain. The sciatic nerve function is it carries the function of both sensory and motor. In sensory is nothing but it will give sensation to our leg. Okay, motor function also it has. This is the cause of the sciatic nerve. Patient may complaints of pain in low back ache or from buttocks. The pain may start, but typical presentation of sciatica is the radiating pain. Once the patient complains of pain from low back ache, which is radiating till heel, it is 90% of sciatica. See, in sciatica, if I want to tell you the prevalence, 40% of US patients are suffering from sciatica. But irrespective of gender and age of the patients, it is very less common in below 20 years unless it is of traumatic conditions. If some traumatic conditions are not there, of course, it will be seen after 35 years of age in females, after 40 years of age in males. Okay, it is not seen in any other conditions at very young age other than these traumatic conditions. See, radiological, sciatica is a clinical diagnosis, so we need to give more importance to our clinical examination, neurological examination, as discussed before. And here, of course, radiological investigation first they do X-ray, then they'll go for MRI. But for Ayurveda doctors, once the clinically it is confirmed that sciatica, I didn't recommend a patient for any radiological investigations because you may know we're all experts in sciatica patients because most of the patients who comes with intense pain is of sciatica patients. We knew we have treated a number of cases, so sciatica we could diagnose very easily. So I didn't recommend that patient to go for any X-ray or any CT or MRI investigations. See, to look for the nerve, it is not the CT, it is the MRI which is advised to the patient. MRI, any patients comes with low back ache or which is radiating pain, which is always related to the bones. It is the MRI radiological investigations which is advised after X-ray. No any intervention of CT scan here. So students, if some students are here, they should know. Otherwise, the practitioners already knew it. CT scan that is for abdominal cases like soft organs, you will get to know from CT. Contrast is done. Some plain CT and contrast CT radiological investigations are done. That is for soft tissue and soft organs. But for hard organs, it is the MRI which is advised in case of bones, nerves, or ligaments or tendons, anything. Okay. Next, how I treated that patient, how I approached that patient. So the treatment is Yoga Raja Gugulu. We all of us know any patients comes with history of pain which is related to the bone. The choice of Gugulu is Yoga Raja Gugulu. That's what I advise. It is, see, of course, it is a successful case series, but the treatment is not that different. It is the one which is followed in our classical method. Rasta Saptaka Kvata, we know it is advised in Vata Vyadhi, 10 ml TID before food. See, any patient, if I advise this Kvata, so I'll advise them to take it before food. That is an empty stomach, okay? This Kvatas. And Dashamula Arishta, 10 ml TID after food, which is mixed with 10 ml of water. It is not given as it is, any asavas or arishtas. And asavarishtas has to be given after food only. Why? Because it is a one which contains alcohol. It shouldn't be given in empty stomach because it may erode the mucosa of the stomach and intestine. That's why. Chandraprabha Vati one-on-one after food because patient is a known case of diabetes mellitus from past 20 years is on treatment. He might had some diabetic neuropathy cases or dermopathy cases. He was complaining. See, I have not included here, but he was complaining of some blackish discoloration over his leg. So Chandraprabha Vati, which is advised even in Prameha and complications of Prameha. So that is the broad spectrum of our Chandraprabha Vati that with this the speciality of Chandraprabhavati have described even in Ayurveda case series 1 also. Because if you don't know anything for a disease who comes to you, you can advise Chandraprabhavati. Why? Because if you go through the indications of Chandraprabhavati, all the systems of our body are involved. Even respiratory problems, GI problems, and dermatological problems, bone problems, surgical conditions also. Arbuda, Bagandhara, Harshas. In such condition also Chandraprabhavati was advised. Such a wonderful drug Chandraprabhavati is. So for local application, patient have pain, we need to advise something. So Mahanarayana Taila and Ashwagandha Lakshadi Taila, both of them are advised. Why I have chosen Mahanarayana Taila is patient has pain, of course. Uh, Even if you ask any layman person, he will tell Mahanarayana Taila is the one which is good for pain. I want to decrease the pain, and one more thing is Ashwagandha Lakshadi Taila. Patient is of 76 years old. He's a lean person. I want to give some nourishment to his skin, muscles, and bones. So Ashwagandha Lakshadi Taila is advised. And therapy I advised for 8 days. The therapy is Kati Basti followed by Sthanika Abhyanga and Sveda plus Yoga Basti. So this is an ideal treatment for any patients who comes with sciatica in almost all the Panchakarma centers. See, Kati Basti and Sthanika Abhyanga is given with Ashwagandha Balalakshadi Taila and Sahacharadi Taila. Sahacharadi Taila is the best Vatahara. I wanted to give some nourishment to the patient because that his age is 76 years, he seems to be lean, so it may be the degenerative disc conditions. So ABLT was advised. Yoga Basti, for Yoga Basti, Niruha Basti I have given. Says Yoga Basti, it is for 8 days Anuvasana, Niruha, Anuvasana, Niruha, Niruha, Anuvasana, Anuvasana. For Niruha Basti, what I have chosen is Dashamulakwata, Balakwata, Manjishtadikwata. Dashamulakwata Vatahara, Bala to give nourishment strength to a patient. Manjishtadikwata because patient has some discolorations over his lower limbs that may be due to diabetic dermopathy. So I wanted to work on some blood cells also. So I included even Manjishtadikwata along with these two. And the Taila Gruta, Panchatikta Gruta, this is the Gruta, so sorry, I have mistaken, it is the Kashaya, Panchatikta Gruta, Sahacharadi Taila and Ashwagandha Balalakshadi Taila, 70 ml was given, and Panchatikta Gruta, you remember that is not Kashaya, that is the Gruta, 20 gram, Saindava Lavana, 3 grams, and honey, 10 ml, I included Shatapushpakalka, 5 grams. I triturated these one to make a homogeneous mixture, then I gave Niruha Basti to a patient. For Anuvasana Basti, Sahacharadi Taila and Ashwagandha Balalakshadi Taila is given. Of course, it is not supportive. I will show a video. I included some videos in that to show you, but I'll definitely show you after completing this one. This is how I treated this patient. Okay. I will show you some other. I hope all of you can see. This is the antalgic gate. See, whenever you see a patient have pain in right side. So that's why he is not bending towards the right side. Okay. He is bending towards the left side. So that is known as antalgic gait. See, this is the patient testimonial. I hope all of you can hear. This is the testimony of the patient. Okay. This is Niruha Basti preparation. And this is how I gave Anuvasana Basti. This is how we treated patient. If you have any doubts, you guys can ask. Otherwise, we'll wind up the session. See, this is a case series of sciatica. Only one case I discussed last class. I discussed 4 to 5 cases in under the condition of jvara. Why? Because many patients, about 40% of patients in US, it was there, but nowhere survey was being done in India. Uh, the prevalence of such cases are very difficult. Patients have been suffering from such conditions. If even if you tell your relatives who are around you regarding the conditions, we had good treatment here. You saw the testimony of the patient. 80% of pain vanished within 8 days. The pain was severe. If they just take another 8 days therapy along with the shamana aushadis, we will definitely see improvement. I may guarantee we will definitely see improvement if the patient takes medications very regularly and there is no failure in such cases. Okay. So this is how we treated patients in Vata Vadi. Next class, we will meet with one more case discussion series. I hope you understood sciatica. Anyone have any doubt here? The students, 3 members are any practitioners that have joined. There are 3 members. If you have any doubt, you may ask. Otherwise, we'll definitely wind up the session. And if you need any class regarding any particular disease, you may ask. So we'll prepare according to that. We had been practicing from past 5 to 6 years. So we will concentrate on such conditions and we will present the same conditions in next coming series. I hope nobody have any doubts. So we shall wind up the session.